Fourth part of the quality assurance system we've got going on is monitoring of the protocol implementation, and we've got 4 pieces. There's data quality, pill dispensation for the pill trials, laboratory procedures, and performance. Lynn did a phenomenal job at laboratory procedures, so I'll be showing a little bit of a correction on my slide when we get to that. And then performance, you'll see that we're still working out the details, but the concepts will probably sound very familiar to you. And Mike and his group gave a phenomenal detailed description and hands-on experience with some of what we'll be looking at in data quality, and that we've got a lot of automated range checks and validity checks all along the way to help guide that everything is completed in a correct and timely manner. But we'll also be providing reports periodically. I don't know if all those systems are worked out yet as far as how that's going to be implemented, but you'll have access to reports, activity reports, to look at timeliness of data entry, and we'll be at the DCC. That's our job, in essence, that we need to make sure that we're covering and monitoring that. Pill dispensation, Fisher Bioservices, that'll be packaging the pills. They've got a system of QA to make sure everything's going straight, and like Barb Cochran said, we'll have a way to monitor the dispensation at the field centers themselves, at the network sites. Laboratory procedures, make a correction on your slides that are in my piece here. We talked about this first point, likely 5% double-blinded QC. Well, Lynn's given you the current, up to the minute, that piece. So just you can cross through that and say refer to the presentation on specimen collection. And we expect when we do quality assurance visits that we will be watching some of these activities. Performance monitoring, very common, we're no exception. That we'll be looking, you'll be looking, and we'll be looking at recruitment rates, enrollment rates, task completion, forms completion, et cetera, et cetera, et cetera. And that's partly, you'll be doing that on site yourself as leads, and partly when we do QC visits, QA visits, we'll be looking for that aspect as well. We provide the activity reports and the observations and the file audits to help us along the way. We're in it together. We're all here as part of Ms. Flash, so the DCC would provide liaison support. Lynn is your clinic liaison, and we also have in the works an email query system or some manner in which you can submit questions. Responses will be returned and shared amongst all of the network sites, as well as periodic, I don't know if we've decided a frequency, maybe once a month, of study email updates. Quality assurance site visits. We expect we'll be doing conference calls sometime during recruitment. You heard from Julie that she's expecting to get those started. So all we want to do is make sure that you're feeling supported and providing you with guidance if you don't have it already, and giving you an opportunity to share with each other all of the tools and the techniques for recruitment. We have currently budgeted 3 QA visits per site. So that's something also that in your slides on your handout there, it's 1 per trial per site. I don't know that that's going to work out, but what we currently have budgeted is 3 overall per site. And I think not every site is necessarily doing every protocol. That may be determined as well. And we'll go through the QC visits, when the QA visits, when we did them, and the Women's Health Initiative lasted anywhere between 1 day and 1.5 days. Those of you who've participated, is that about what they are in other trials that you've received QA visits from? And we also, hopefully, I think we plan to expect to provide you with the opportunity to send questions to us ahead of time so that we can have some set-aside problem-solving sessions during the QA visits to help things along. And we are providing reports back to your sites and to the program office. Participant file audits. Anybody here who's not had participant file audits, you may not have if you've not been part of it, but we'll be likely requesting photocopies of a random number of participant files, and then we just look to make sure all of the documentation is there, that the forms are completed correctly. If there's editing to the forms, we'll be giving you information about how to do that and making sure that part's done as well. You can see there's a lot of pending, the details to be worked out. Steady monitoring, this is when we actually get into some of the data, and there will be reports to annually from us to you, as well as the Data Safety Monitoring Board reports that will be distributed to Data Safety Monitoring Group during their meetings to oversee. They will have access to blinded data, and that will not be shared. So that's the whirlwind tour of the QA elements of Ms. Flash, the shell that's forming. I'm glad to answer a few questions. I know we raced through this pretty quickly, but it's really conceptual at this point. Comments, questions, concerns? Yeah, Lisa.
When you have a QA or QC audit, about how much notice do we get, or at least?
You'll be given, we don't know the exact amount of notice, but it's not meant to be spontaneous. There's definitely the intention, if we follow the model that we've worked with before, we coordinate dates ahead of time, and there's a good, I would say, usually 3 to 4 weeks. I mean, we've got to arrange flights and things like that, so yeah. It's meant to be collaboratively aimed to support the trial.